Thank you very much. Thank you, and good morning. So Roy is related to Miles Standish. I'm going to have to work that into one of my speeches one of these years. And he stole my thunder. I was going to talk at some length about the resource guide. It still deserves lengthy conversation because it is such a game changer, I think, in being able to provide an encyclopedia for compliance officers and their colleagues around the community. He did a great job of summarizing it, and it is going up this morning as I speak. And we'll work that into the conversation that we're going to have about what I consider really a second era for the compliance industry. I think we've now been in the business for about 20 years as an industry. HCCA celebrated its 20th anniversary. And those of you who have heard me speak before know that I am a history buff. That's why I find the Miles Standish relationship so interesting. And for those of you who have attended, you know that we've been going back in time to make some interesting analogies to the compliance world. We had a talk about the architecture of compliance and comparing it to the ancient pyramids of Egypt, and the dangers of fraud by talking about the Florentine Dante from the 14th century in the Inferno. And more recently, we had a conversation about institutional failures that result in something like the Titanic going down. I'm going to avoid going that far back. I'm going to try to be a little bit more contemporary because I do want to emphasize that just within our careers, at least for many of us, we have seen a very important arc occur. I just want to roll the tape back 20 years to the passage of the Health Insurance Portability and Accountability Act, the 104th Congress, and the landmark legislation that changed the face, certainly, of the Office of Inspector General. It created a much larger IG, and of course it was important in the creation of HCCA. And to think about the architecture of HIPAA as it relates to what we do as an office. Certainly it bulked up our ability to pursue healthcare fraud by creating this healthcare fraud account. And I would underscore that it was to be shared. This is a shared account between HHS and the Department of Justice. And it was very important that we work in concert with local law enforcement partners as well, with the Medicaid fraud control units, to attack the growing problem of healthcare fraud. Keep in mind that 20 years ago, Medicare and Medicaid were in total about $300 billion. We're now 3.5 times that size in dollars from 20 years ago. Much larger programs. But that healthcare fraud account has been extremely important in being able to tackle what is generally considered a very serious problem, both in terms of stealing taxpayer money and potential patient harm. It was important that we come up with a horizontal approach, making sure that the federal partners and the state partners work together on healthcare fraud. And on a proactive, on a positive front, I consider that kind of the defensive posture. On a positive front, I think it's important to keep in mind that HIPAA encouraged OIG to issue advisory opinions, to issue guidance, and as you probably know, certainly the veterans are familiar with our compliance program guidance that dates back in the late 1990s, beginning with our hospital program guidance, that we built really a library that's easily available online, in which, again, we work in tandem with private industry, the private healthcare industry, to make sure that we're really covering all of the important aspects of compliance that Roy mentioned earlier. then there again, I want to emphasize how important partnerships were. That is the path that we're taking. We're telling a compliance story in which we're not looking hierarchically, but we're looking very horizontally at who can assist, who can help, who brings the right expertise. And I think that was established 20 years ago. And a lot of it has to do with building both the human factor and the enormous change in technology. And we're going to get to technology in just a few minutes. But I do want to underscore how important it's been for the partnership that has occurred. You know, in Washington for the last few months, you probably noticed that there have been a lot of meetings going on between government and industry, all corners of industry. Partnership is very much in the air. The notion of government and the private sector need to work together to figure out how to maximize productivity, profitability, make sure the country is prosperous, make sure its economy and its people are healthy. There's been a lot of struggle going on to try to make that happen, but it's been very much an effort that is very designed to bring the different sectors of our economy together. Well, we've been doing that as a community for 2 decades. That's the wonderful thing about how we've developed a relationship where we can really work through so many of the compliance issues that are so significant in healthcare, do it by bringing together expertise from all aspects. And again, I think that the January sessions where we brought together compliance officials, we brought together outside counsel, healthcare consultants, as well as a variety of expertise within our own office. I think it's so significant that we were able to bring together that kind of horizontal, again, collection of expertise to help come up with, again, such a valuable product, something that will be a very important part of what I call Compliance 2.0, that we're really looking at a different era in which, by thinking very carefully about how we can bring together technology with the right expertise, we'll be able to make the right thing happen. But we need to be able to tell that compliance story effectively. And now that we have those kinds of tools, the things that we're working on in tandem with our partners, and I also want to note, as Roy mentioned at the top of the hour, HCCA has recently acquired the Medicare Compliance Newsletter. Your newsletter did a very good job of summarizing the compliance guidance that was issued by the Department of Justice back on February 17th. That noted the kinds of things that the Department of Justice will be looking at in fraud cases as far as the kind of environment that exists in particular enterprises that are the targets of Department of Justice investigations and possible prosecutions, building on the Sentencing Commission guidelines. Again, a very valuable document that you provided a very, very useful summary for. When I talk about Compliance 2.0, I want to focus on the human factors that have really developed over the last few years as more and more people have thought about what it means to have a corporation, a company, an enterprise really devoted to being able to maximize the resources at its disposal. And we were served up a very useful vehicle in the last year or two, thanks to CFO Magazine. It appeared in CFO Magazine in 2015, the beginning of a study that has most recently been further explained in a working paper that was issued last week by the National Bureau of Economic Research in Cambridge, Massachusetts. And I would encourage you, if you have a few moments when you're surfing the web, to look at nber.org and look at the most recent working paper on culture in corporations, evidence from the field, how important corporate culture really is to a company. And I think it was especially valuable that this was done through CFO magazine, that the financial industry was interested. These were researchers, mostly from Columbia and from Duke University, but who in coordination with the American Finance Association and the American Accounting Association and a number of other academic institutions, Fordham and CUNY Baruch and Temple and the University of Virginia, Washington University of St. Louis, a variety of educational institutions working with the financial industry, looked at 1,348 different North American firms. And over the course of the last couple of years have been asking, what is important? Is the culture of a corporation, is the culture of your firm important? 91% of executives say that culture is, what do we mean by culture? We mean, of course, the tone that's set, style, the behavior, the interaction of norms with culture. It's one thing to state values, but are those actually followed day to day, that relationship of values to norms to actual behavior? How important is that? 91% of the executives said it is one of the top 3 or 5 drivers of value for the firm. When it comes to productivity, to profitability, to innovation and creativity, 91% said it's the culture. What is the culture? Is it a culture of collaboration? You have trust, coordination, communication among colleagues. Is there accountability for decisions? Do people take ownership? Is there passion about the business line? In healthcare, fortunately, we're in a line of work where passion should be pretty generous in coming. And I think, I certainly know in talking to many of you over the years, that you're very passionate about this field. Passion's important. Diversity is important, especially in the United States today. If you're not thinking diversity, if you're not bringing everybody in, you're missing huge opportunities. And you're really destabilizing your own industry, your own firm. Passion, diversity, quality. Are you proud of what you do, and do you emphasize it? Is it important to you? And of course, integrity and honesty. So it's collaboration, it's integrity, it's accountability, it's diversity, it's quality, it's passion. Those are very, very important cultural values. And when asked, and again, we're talking about hundreds and hundreds of executives representing hundreds and hundreds of firms throughout North America, some in healthcare, many not. When we ask them, does your firm have the right culture? Do you think you are where you're supposed to be? 15% said yes. 15%. And 85% believe that a culture that is not driven by the right values is in great danger of making ethical mistakes and making legal mistakes, committing crimes. And what was interesting was the researchers concluded that this is the most under-researched component of what drives value in both the United States and around the world. And the notion of CFO Magazine's study, in large part, was to surface the issue and then encourage further analysis to try to drill down and provide some further quantification. Again, the fact that it was the financial sector, it was the finance people, the hard-nosed folks, These are not the people who are the sociologists or the psychologists. And you can say, well, that's kind of soft. These are the people who really do need to think about the figures at the end of the day. And they're saying it's culture that really drives a lot of the value. And I think that change that's occurring over these years, thinking about the value of culture and the importance of leadership in it, 55% said the most important component of creating the right culture is the CEO. And indeed, we're looking at the top. DOJ focuses on that. We need to have an idea of what the tone at the top is. OIG focuses on that. What's the tone at the top? When we're looking at CIAs and trying to understand what the internal culture of the enterprise is. And sure enough, everybody seems to agree with it. So it's an extremely important part of how we're thinking about culture. And that's the human component. What is remarkable as well today is the technology component. When we got off the ground in the mid-1990s, it was really the beginning of the internet age. A lot has happened in 20 years technologically, as we know, and now we have the kinds of tools that we couldn't have imagined 20 years ago. And that's giving us the ability to also work effectively as partners. On the healthcare fraud side, we're working very productively with the Healthcare Fraud Prevention Partnership, with private payers, and us at the table being able to navigate data that we couldn't imagine being able to do back in the mid-1990s. But now we're really being able to share important information about fraud, about risks, about risk areas, and about the kinds of things we see both on the private and the public side. So we're able to catch various schemes much, much earlier than we had been able to in years past. And that is, in large part, certainly you need the human motivation, but we now have the technological tools to help make that work. And technology, of course, is reaching us in a very personal way. I don't know whether you use a fitness tracker. I have one. I'm not sometimes sure exactly why I should have it, because I'm not sure exactly what my outcome really is going to be by using it, but at least I'm thinking about it. Why do you use a I know a lot of us use a fitness tracker. Do we use it to lose weight? Do we use it for cardiovascular health? Supposedly 10,000 steps is the gold standard. Is that important? That's an output. I don't know, but what's the outcome of 10,000 steps? Does it matter how you do the 10,000 steps? If you do it walking 2.5, 3 miles an hour versus doubling that, jogging or running, does that make a difference? I think it does. Maybe you're wearing it because it looks good. I mean, it can be a fashion statement. In my case, I mean, it's useless to do that, but I do think that there are a variety of motivations when it comes to fitness trackers. It's an example of technology making us think, though, about how we're able to translate data into something useful that actually may result in a changed behavior that then gives us maybe a healthy outcome. And that's not bad. This is a case of observing, measuring, and then assessing the value of it. Those are important components. Observe, measure, and assess. There were a couple of very contemporary reports in the last week or two about the notion of the importance of being able to assess things. There was a quote from the chief economist of the Bank of England was trying to explain to the press the problem with so many English companies underperforming, and said, I guess if he was an American, he'd say, they're always trying to hit home runs. They're not trying to hit singles and doubles. And the notion is, if you're always trying to hit a home run, you're going to strike out a lot. But if you hit lots of singles and doubles, the runs will take care of themselves. They will come in. Look for the incremental gains. Look for if you can do marginal gains regularly, you can do some pretty remarkable things. The analogy he used was to the Olympics, where he says, if great athletes can shave a second or a half second, even sometimes a tenth of a second off a previous record, well, after a few years, all of a sudden, you've got world-shattering records. And it wasn't because an athlete showed up and just blew everybody away. It occurred over time with important, seemingly small, but important incremental gains. And I think so much of the technology story over the last 20 years, and now that's going to accelerate, is happening now in healthcare. And it was very much on my mind when I saw a recent story about, and this was in the New York Times with a blurb, and I think it's on the web from the last week, where some Harvard researchers looked at the death rates, the 30-day death rates of Medicare patients from date of admission, looked at the 30-day death rates for Medicare patients based on their weeks of admission, whether they were admitted during a week in which the Joint Commission was doing its inspection versus the weeks before and the weeks after. I have a sense that you may know the result of this, even if you didn't see the story. But I want to underscore that the difference, sure enough, the death rates were higher during the non-survey weeks. But I would underscore that the numbers weren't huge. It wasn't large. It was 0.2 of a percentage point or 0.3. It amounted to about 3,500 additional deaths a year, in the non-survey weeks compared to the survey weeks. We're talking about 1.7 million patients, nearly 2,000 hospitals. So I think it's important to keep it in perspective. This is not an effort to slam hospitals. And I thought that it was really thoughtful the way the Harvard researchers, when asked to explain the results, what does this mean? They said, well, it's probably not a good idea to try to replicate the stress levels of hospital personnel when the Joint Commission inspectors show up. But what we should do is think about how we may observe what kind of behavior occurs that may be distorted, the kinds of distractions that occur with respect to documentation and the other kinds of protocols that typically happen. Because people tend to be less distracted during the survey weeks. So just look at those behaviors, assess them, and think about how you can change a culture in which every day you can count on that day being a high performance day. Because that's really what everybody's looking for. And speaking as a Medicare beneficiary, I would never resist. If I needed to go to a hospital, I wouldn't say, well, is this a survey week or not? That's not going to keep me from it. We're not talking about those kinds of numbers. On the other hand, if you're related to one of the 3,500, it's a big deal. So I think we need to keep in mind the importance of incremental gain. Incremental gain is a big deal. It can be very helpful, and we need to keep in mind how we make that happen. That's why I think it's so useful to have the guide that so many people worked hard to produce this year, to give you the kind of menu that makes you think in terms of these kinds of incremental gains. That's the kind of work that over time really makes a difference. And with the kind of technology we have, in years past, I just don't know whether the Harvard researchers could have turned around with the kind of data they were looking at, 1.7 million, 2,000 hospitals. It didn't sound like it was really that complicated to work out the actual numbers so that you had something meaningful fairly quickly. We also, as an office, just so you know, OIG also is very, very focused on observing, measuring, and assessing our own performance. Because, as I said, the volume has grown enormously over the last 20 years. We now have in excess of $1 trillion to oversee. We don't have that large a staff, 1,600 professionals for over $1 trillion worth of expenditures in an area that unquestionably is among the most complex in American society. I mean, it's a modest amount, and that's why, of course, it's vital that we do the partnership work we do. I mean, you play an instrumental part in helping us advance the cause, and we do it through a variety of federal and local enforcement partners as well as the private sector. But when we look at the various areas of vulnerability, some of the ones that have really surfaced importantly are prescription drug abuse and, of course, the opioid epidemic, which is of tremendous concern to everybody in the country, as it should be. Our Part D team has noted that we've had about 30,000 overdose deaths. 60% of overdose deaths have to do with opioids. A number like 30,000 is unacceptable. It's wrenching the social fabric of the country. It's obviously a financial drain, but it's patient harm, important problems with respect to diversion of drugs. And that's why I'm so grateful that Gary Cantrell from our office, our head of investigations, devoted several hours yesterday to this topic. I hope that some of you were able to catch him and to catch the session. Extremely valuable. Home health services, I think that's a very significant part of the new landscape in healthcare as we move more and more out of institutions towards more local kinds of solutions for healthcare. Home health is now such a large part of what we see. We spend probably $18 to $19 billion at HHS on home health agencies for 11,000 different providers. And there are serious vulnerabilities when it comes to home health because it is more difficult to track. We had a fraud case in Texas with a doctor named Jacques Roy that resulted in a $375 million false billing case. And this centered around really a conspiracy of taking advantage of the home health agency benefit. So this is an area of tremendous focus for us. And of course, Medicaid program integrity remains a very, very significant challenge because as we move more and more towards managed care, from the standpoint of us as auditors and evaluators, we see a system that's much more opaque than really suits our ability to assure that taxpayer dollars are being used appropriately. We want to make sure that we know who we're doing business with, that providers are qualified, the money is going to people who deserve those fees, and the population is actually being served appropriately. This is a problem that comes up with personal care services. We've had instances in which one-to-one requirements in personal care services where an attendant was supposed to be watching a beneficiary and failed to do so, and the beneficiary winds up dead the next day. These very often can be life and death issues, and our Office of Investigations has issued an investigatory advisory on personal care service and the vulnerabilities that can occur within, again, a large and growing portfolio. So we ourselves are looking at how we can use our modest resources to really focus on those areas of vulnerability that we really need to focus on now and at least for the foreseeable future. Again, the new resource, which is the Measuring Compliance Program Effectiveness and providing you an incredible number of metrics to work with. And as Roy said, as a practical matter, you're not going to use all 500. But on the other hand, you're not going to attend all 150 sessions this week at HCCA. You just can't do it. So using the same professional judgment that you exercise when you plan your week at HCCA, you can figure out, you can plan, you can assess what are the particular areas within those 7 elements and all of the ideas that are captured in the 7 divisions of the resource guide, which ones really make the most sense for you at this point. You want to make sure that you have the desired impact, so you need to target those resource guides to your particular needs. I want to make brief mention before I leave about the number of people who are here from OIG being a part of HCCA Week, and to express to them my thanks and to encourage you to take advantage of this incredibly valuable resource. Today is very much Prevention Day, and we're talking about corporate integrity agreements. And because of the recent developments with CIAs and the way that we're now able to focus attention in a much more laser-like way, I think the evolution of CIAs from a broader tool to understand whether a system is operating reasonably well to being able to focus on particular areas of vulnerability is a real step forward when it comes to CIAs. And we have several important breakout sessions devoted to the topic. Susan Gillen is speaking later this morning about the successful corporate integrity agreement elements. Nicole Cosi early this afternoon on OIG's new CIA form, and Laura Ellis making the most of the CIA later today. All 3 very valuable presentations. I also note that Heather Westfall will be speaking tomorrow on kickback and Stark law developments. This is a nice compliment, actually, to the great work that Lisa Ray did yesterday talking about False Claims Act developments. Again, we need to keep in mind these are very important landmark pieces of legislation that we continue to work with as a community as a result of some of the new coordinated care models that are coming down the road. Of course, it's important to keep up with how kickback and Stark law may evolve because of the new models. The False Claims Act that Lisa was talking about remains, of course, a bedrock when it comes to healthcare fraud. And regardless of what might be waived with particular accountable care organization models, the False Claims Act, of course, is never waived. A false claim is a false claim, but that only begins the conversation. And I appreciate Lisa devoting so much time with colleagues to talking about those developments yesterday. On detection, tomorrow will be Detection Day. Karen Glassman will be talking about compliance, the C-suite and the board of directors, what to report and how. Given what I've talked about this morning, we know that that's incredibly valuable, and of course, you knew it before today in any event. And I also want to underscore the value of tomorrow's session by the Deputy Inspector Generals of our office, Christy Grimm, Gary Cantrell, Greg Dembski, Rob Owens, Sue Murren, and Gloria Jarman. One of the most valuable things about that session, and because I have the pleasure and the honor of working with these people on a regular basis, is not only the expertise they bring to their particular component. You know, we're talking about expertise in law enforcement, in auditing, and evaluation, and management analysis. The interaction, the thinking that goes on when these areas of expertise interact is invaluable. You can't put a price tag on that. So it's the conversation that I think will be especially valuable. On enforcement, which is ubiquitous, we're covering that today and tomorrow. So we have Laura Marziani on federal administrative sanctions, which, as many of you know, has bulked up in our office. We've created additional resources available to look at civil monetary penalties and exclusions just in the last year or two. A worthwhile session. Sarah Kessler will be talking about managed care fraud. Again, because of the opacity, it's important that we focus on that, and it's a major part of our activity. David Fuchs will be talking about self-disclosure, obligations, options, and outcomes, because self-disclosure protocols have always been a very important part of demonstrating that we're really on top of our compliance work, and that when a firm sees a problem, it doesn't wait in the hopes that it can just be avoided, but it comes forward and makes whole the taxpayer and ensures that the firm is able to move forward ethically and legally. Kenny Kraft will be talking about strategic considerations in resolving voluntary disclosures to government offices. And that is going to be a very valuable session as well. You can follow us, as you know, on all of the social media, and I think that we are about as technologically savvy in operation as you're likely to find in government, with the exception of me. But I would not want to close without mentioning one final thought, because if I slipped on a banana peel tomorrow, I wouldn't want it left unsaid. A couple of weeks ago, I was appearing before our appropriators in the House Subcommittee on Health, and I was there with my fellow IGs for the Department of Labor, Social Security, Department of Education. And it was a very full session. We had a full 2 hours, and there were a number of members of the House of both parties who attended, asked many questions in a variety of areas. And towards the end of the session, every member who was still there, both sides of the aisle, went out of their way to express their gratitude to us. They thanked us. They thanked us for our public service. They thanked us for protecting the programs. They went to some lengths, and it was unanimous on that side. I mean, for those that remained, they were all expressing their thanks. I didn't return the favor. You really can't do that at those kinds of hearings. That's not the appropriate setting to say, well, and thank you for your public service. But as I left, I certainly had the thought that I needed to pay that compliment forward. So I'm doing it now. I want to thank you for the work that you do, for the thought that goes in to your compliance work to make this such a successful. We have a very, very good healthcare system in the United States. It is not a system of corruption. It is not a system of recklessness and negligence. It's a system that cares. And systems, of course, don't care. The people who make those systems happen, those are the ones who have to care. And I thank you as compliance officials. And I also certainly thank outside counsel and healthcare consultants. I speak to those folks more often than you might think. And I thank them for also being part of significant solutions that we need to come up with every day. It is always a great pleasure and honor to be with you. Have a great week. Thank you very much.